Assalamu alaikum for those of you that are watching at home and the Muslim Charities Forum Facebook page. Welcome and welcome to the Muslim Charities Forum volunteer webinar. We've got a packed hour lined up for you with loads of guests as well as volunteer guidelines and so on. I'm Abdullah from Islamic Relief and I'll be your host with.
I'm Fatima Akhtar, so I'm from Human Appeal and I'll be co-hosting with Abdullah, and I pray you are all well.
Jazakallah khair, sis. How's your day been so far? How's everything going with the stuff that we have on our plate?
It's been exhausting, and I'm sure you understand, what's happening as well. So with Islamic Relief, Human Appeal, all the charities, we're just pulling together now and just trying to get through this together. How are things down in London? Because I know it's even stricter down there.
Yes, you're from Manchester, I'm from London, and our other colleagues are all around the country. I just want to say, first of all, mashallah, all the charities coming together for campaign for national solidarity and the Muslim Charities Forum. And it's great to show unity, unite, especially in this time. And I think it's important we try and have webinars like this where we share best practice. So in order to safeguard our volunteers, ourselves, and our family. So if you're watching, definitely like the page, share the page, and tell your friends. I know you probably thought, okay, you've seen it. It's about click, like, and share, and then comment. It is an interactive show. It's not just about us talking and our guests talking all the way. It's also about you asking us the questions, as both of us are professionals working in this sector and volunteer coordinators for a very long time, as well as our guests will hopefully help you navigate through that. So before we go on, I think some of you probably asking, what is Muslim Charities Forum? Who are they? What are they about? And I think it's a very good time to bring in our first guest, Anas, who is the executive, is here at the moment, as you can see. Can you tell us, Anas, what is Muslim Charities Forum? What are they about?
Assalamu alaikum. Thank you, Abdullah. So yes, my name is Anas. I am the Project Development Executive at the Muslim Charities Forum. The Muslim Charities Forum is the network, the umbrella body for the British Muslim charity sector. We aim to collectively build a more accountable, transparent, and efficient British Muslim charity sector. As Abdullah has mentioned, we have launched the Campaign for National Solidarity. This campaign, as you've seen, is an idea that we can overcome this difficulty, we can overcome this hardship that our society is facing if we come together. So part of that is by coming together and providing funds for those who need it the most. As well as that, it's also about how can we work together as volunteers, as charities, as mosques, as community organizations, how can we work together to support those most in need? And part of that aspect of it is why we're doing this webinar today, to help you all volunteer, help those most vulnerable in a safe and efficient way. Thank you. Back to Abdullah.
Jazakallah khair. Thank you very much. Hope that they're watching now. You've invited your friends along to watch it with us. So what we've got planned for you today, we'll be talking about volunteer guidelines. So how do we safeguard ourselves and others whilst we are doing important tasks of delivering food or delivering food to the hospitals. And we'll be obviously taking those from the government guidelines. As you can imagine, we need to be really strict and compliant with those, because obviously we need to safeguard ourselves and those around us. And finally, at the end, we will also be an interactive show. So any questions, start writing them in the comment below section, and then we will have that on. Who else have we got on the show as well, Sister Fatima? Who you got?
So we're really lucky to have some guest speakers with us today. So we have pharmacist Sharifat Mohammed Kamal from the British Islamic Medical Association. So she's going to be talking to us a little bit about having healthy minds and healthy bodies during this time. And we've also got the director of the Muslim Youth Helpline, so Zara Kaku, who will be discussing mental health and well-being. So before we invite our guests, and before we start any of that, we'll look at the volunteer guidelines, as Brother Abdullah said, and answer any questions you might have about getting involved. But I think the biggest question that everyone is wondering and everyone is thinking, Abdullah, are people still allowed to volunteer during this time?
That's a very good question. I think a lot of you watching at home have seen people volunteer, and this is what the government guidelines is. You should only leave the house for limited purposes only, and they've listed 4 things that allows you to go out, obviously. One is around shopping for basic necessities. So if you need to do your household shopping, you need to go to the pharmacy to pick up medicines, that's one. Number 2 is a form of exercise, an hour a day. And we'll talk about that a little bit later and delve into that with our guests around the importance of having that exercise a day. And third could be any medical needs, so going to GP or giving blood. And here is a crucial thing that we've highlighted here on the red is provide care or to help a vulnerable person. So this is where some of us who are volunteering were able to do that because of that particular reason. And the number 4th reason is traveling for work purposes. I know some of you are working in retail, customer services, front-end takeaways. MashaAllah, you're doing an amazing job, as well as our healthcare professionals. You guys are doing an amazing job, and you're risking every single day to go to work and from in order to help those countless lives. Okay, so you're probably thinking, how can I help? Those that are thinking, how can you help? It's important, and we've got this slide, is to think about, okay, I want to help someone, but I think sometimes what happens in our community and ourselves, we get this Superman syndrome where we want to go out and help everyone, do everything we can, but it's important we try and adhere to this as much as possible. So you can only support people, remember, if you fulfill all the conditions below. Okay, it's important you fulfill all the conditions below. One is that you're well and have no symptoms like cough or high temperature, you or anyone in the household. So you might be living with your elderly parents or family members, and they might have it, so it's important you isolate yourself with them. Or if you are under the age of 70, you're pregnant, and you do not have long-term health conditions, and they're listed on the government website like diabetes, asthma, and so on. So if you have any of those 4, by all means, please don't think, I'm a superhero, I'm going to go out there and save all the people out there. Don't do that, inshallah. And finally, one important point always to mention is check the organization that you're volunteering with. Alhamdulillah, Muslim Charities Forum represent all the charities out there as a coalition. So each charity has its own guidelines, safeguarding rules and procedures. So ask them, can I volunteer for you, and what can I do? Is that okay? So those are very important points to think about. Fatima, I was going to say, mashallah, we've seen some great examples. So those of you at home, you've seen on so many charities' Facebook of them going out. How can and what can volunteers do?
There's still plenty that volunteers can do to support their local communities, and it starts with helping friends and family and neighbours who are in isolation. So remember, charity starts at home. So the first thing you do is probably help people with food shopping, okay? Shout out to our retail workers and people who are supporting us there, keeping them supermarkets running. But people are staying at home because of coronavirus. We need basic necessities, just like we need basic necessities. So you can do this and leave the groceries on the doorstep, but try and limit the amount of time that you're spending outside of your home. So pick up essentials when pick up essentials when you're doing your own shopping too. Or you can help those who aren't familiar with online shopping. So I'm rubbish with anything online and online shopping itself. Whenever I try and do online shopping, I go into my basket and it's completely empty, even though I've been shopping for an hour. So people do need help with online shopping. So you can actually help by placing an order with them or talking them through the process on the phone. Then we have collecting medication. Okay, so you can pick medicines on someone else's behalf. People should only request the medicines they need. Don't start doing what we did with toilet paper and start bulk buying. Just medicines that you need in the usual quantities. Okay, so this goes for dropping off shopping and dropping off medication. Make sure there's a no contact delivery system in place. So keep a safe distance, leave the items on the person's doorstep, bring their attention to the fact that you're at the door, but then step back and let there be that distance between you, and just make sure they're collecting the medicine and food before you leave. Okay, and also just staying in touch with people. So this can be a really difficult time for a lot of us. Like some of us are just even struggling working from home. Abdullah, how are you finding working from home?
Yeah, it has been tough, but I'm adjusting to it. I think one of the things is around not being able to talk to colleagues, or it's a lot of sitting at home, and it's different, I must say. It has totally changed the way we work, the way we think, and the way we do things.
Yeah, exactly. And thing is, we all are changing our habits, and some people struggle with that more than others. So it's good to just stay in contact with people over the phone, over social media. You know, WhatsApp can. My friends just found out that last week WhatsApp can do a video call for 4 people, and they called me last Sunday. So. And it's something they want to do often because it just keeps them in contact with the outside world. So, you know, again, charity starts at home. So call your relatives, call your neighbors, call your friends, and just say hello and make sure they're okay. Post on social media all you want, but that phone call with them just really makes a difference. And finally, just encourage people to stay mentally and physically fit. It's fantastic if you're catching up on your baking, catching up on your spring cleaning, etc. But some light exercise is really good for people as well. So we have to make sure that, you know, we're keeping active, if possible, if you can, keep active around the home, even just walking around safely in your garden. Little things like that would really help, and it will help your well-being, and that's something we're going to talk about later on in this show. Okay, Abdullah, so I've just talked about someone's health. So what do I do if I'm worried about someone's health?
That's a really good question. I think it's not about just someone else, it's about us as well. I think it's important we try and make sure that we're obviously well and fit. But if you see some of the symptoms, it's important to go online. And so we checked the website, NHS website is really good. It's called Coronavirus Service. They ask you particular type of questions. And then obviously if you think you've got the symptoms or you're showing signs of, obviously call 111. And find obviously without that, and I'm sure I don't need to say this, if there is an emergency, obviously call 999. But I wanted to talk about here around, we spoke about, I know most of us are genuine volunteers, alhamdulillah, and most of us care about the cause, and some of us, mashallah, do it for the sake of Allah. So we're doing it in order to please our Lord. And we're also doing it for humanity because we care for others. Unfortunately, in this world, there are also people who will take advantage of situations like that and take advantages of those that are vulnerable. And so if you've got friends, family, elders that you've been speaking on the phone, like playing WhatsApp video calls and stuff like that, tell them to make sure that if anyone knocks at the door from local authority or anything like that, to show their ID. To be honest, most people won't be knocking at the door. They'll probably be leafleting and so on. And the second thing, they need to make sure that obviously they're not coming in. No one should be going in anyway. But you know, some people who are really bad and fraudulent, they try and do scams like this. As you've probably seen in the news at the beginning, people were out there. So remember, we're genuine volunteers. Obviously, you're instructed, obviously, not to enter anyone's house. So let's try and stick to that, inshallah. I hope everyone finding this useful so far. Please write a comment or text, share by now or like the page, and encourage your fellow volunteers in the community who are doing amazing work to join in. So we're making sure we're going through the protocol correctly. Okay? Okay, if you're volunteering, we've got some basics. Sister Fatima is going to go over that now. Oh, before I go over, I forgot the important page, which is around more information. Most of the information that we've just gone through are from government guidelines. They are obviously on the website www.gov.uk coronavirus. So if you need any advice around volunteering, how to stay safe, if you're self-employed, there's advice for that. If you've got a business and so on, and how to support your community as a whole. So check the website out. And obviously, as you know, every day there's a daily update. Every day it changes. And the stuff we've given probably will be out of date in a days or a week's time. So it's important to always stay on top of the news. Don't want too much news, about some of the good news and important information, inshallah. Is that okay? So now we're going to ask Fatima to tell us what are some of the things that volunteers can do and what are the best practice and so on. So we'll get asked to go over this, some of the best practices. I'm sure some of you are doing, but just a gentle reminder, nudge, nudge.
Okay. Well, Abdullah, I'm not going to talk about people washing hands anymore, because we all know it. We all should be doing it. We should have been doing it before coronavirus, but make sure you wash your hands effectively with soap and hand sanitizer just to remove the virus. If the voluntary work is not delivering food or aid, and it can be done online and from home, take that opportunity, okay? It's really important. Where possible, we try and limit the spread, and we have to do our part in doing that. So we are advising advising volunteers to work online, support us online. All of these charities are now have moved online, so there's always something you can get involved with. Okay, if you have elderly or I can't pronounce this word, but I'm going to try. Should have helped me, Abdullah. God.
Immunocompromised.
Members at home, thank you.
Okay.
Thanks. This is why we have a co-host. They should be advised to prioritise the health of the family. So you need to prioritise the people in your household. Okay, we don't want to risk going out volunteering, doing a great job, alhamdulillah, being all careful out there, and then unknowingly you're carrying the virus home to your family. So let's just be careful about that. And it's also really important to frequently clean and disinfect objects and services that are regularly touched. That's such as like computers and doorknobs, etc. So just make sure you're careful about that. Again, let's do our bit to try and prevent the spread. But what other best practices can we follow?
There's some others around traveling. I think it's important. I know most of you don't travel at the moment, are staying home. For those that are volunteering, obviously it's advisable not to use public transport, unless obviously you're in London like we are. We have to use public transport. So just be mindful about the space, what time you get there, like avoid rush hour. Obviously some of you are working still. Even if you're volunteering, just be mindful about the time that you're using public transport. One good tip might be car share, carpool. Maybe obviously one person sits at the front, one at the back. And maybe taxis, if you're working and you're volunteering, maybe seek those opportunities. Remember, it's a simple advice, but it goes a long way. And most of the charities, mashallah, ask when you join, can we get your contact details, your next of kin, and emergency details? But what happens is we asked you 2 or 3 years ago, sometimes like a long time ago, mashallah, some of our amazing volunteers out there for most of the charities. So if it gets updated that you moved house or you got a new telephone number of your next of kin, emergency details, remind your volunteer supervisors that, oh, I've moved house, or I've got a new number, my parents got a new number, or my next of kin got a new number. Something to think about. If you become unwell because of a high temperature or cough, anything like that, please seek the government guidelines we've said earlier, but also notify your volunteer supervisor and just say, actually, I've been having this and I'm not feeling too well, so at least they can take the right measure as well. And the important thing is around data protection, GDPR. Some of you probably know this, but make sure you don't share people's details. Obviously, people are at the moment vulnerable, and you can't be sharing people's details around and so on. So just be mindful about that. Okay. So we're going to go on to the next item, is advice when delivering an item. I know some of you are, mashallah, shopping, picking up items, delivering them. Sister Fatima, do you want to go over this?
Yeah, so this is something that I mentioned before. Please make sure that if you're delivering items to people who are self-isolating, as a volunteer, it's really important that you don't have any contact, like don't go into the person's home, anything like that. Do non-contact delivery, okay? When you're delivering, try and reduce the risk to exposure. So again, using your own cars. So I know some of you guys are really good drivers, so use your own cars where possible. Avoid taking public transport, like Brother Abdullah said, and just, you don't even have to knock on the person's door if you've got their number. So like I said, help family and friends. If you've got the number, just call them and tell them that you're waiting outside, and just make sure that they pick up and take it into their home. Please do not exchange cash, okay? So fun fact, cash carries a lot of bacteria. So please do not, you shouldn't be taking cash off people anyway, so when they're self-isolated. So please do not exchange items like cash. Yeah.
Over to me. No, but spot on, I think. Cash isn't great. Obviously, if you know someone, look at money transfers, bank transfers, and how you do that. And also, I was going to say, Sister Fatima, which you mentioned about cash, sometimes you might need to do shopping for people, do about £20 limit or something like that, just to be on the safe side. So if something were to happen, at least you're short by £20, not £50 or £100, and so on. Thanks for that. I think we've got some more around collecting prescription. I know those of you that have signed up for NHS volunteering, they've got more information. This is just some of the guidelines that obviously Muslim charity forums have come together, volunteer forum, for you to share. One is around, again, we spoke around data, especially if you're going to go collect prescriptions. So it's important to speak and liaise with the person's prescription that you're going to pick them up from and which chemist. So have a discussion first to find out, are they allowed to, and whether the chemist is allowed to give to you, because they need to seek permission from the person giving it to you. Just make sure about that. Obviously, try not to open people's pharmacy bags if you do get the permission. Be prepared with something the pharmacist will call and check for them. And like Sister Fatima said earlier around dropping the item, leave them at the door and then obviously move away and then let them come pick it up from the door, inshallah. And I think it's important that we try and follow those simple procedures, protocol. I know some of you are thinking, oh my gosh, but mashallah, a lot of volunteers we've seen on social media are doing an amazing job already by doing all this work. All we are here to do is just a gentle reminder and a little bit of nudge to tell you how best to do this. Is that okay, Fatima, so far?
Yep, that's perfect. So shall we bring on our guest?
I think there is time. For those of you that are watching home on Facebook Live, inshallah, do click share, like, and comment. We are going to, you may have a few questions now. I know some of you probably already started writing questions down, I can see. We are going to come back to them at the end. So do write away, comment away, and we will try and read those. So our first guest that I'd like to introduce is Sharifat Mohammed Kamal. She's a pharmacist who heads up prescribing and medicine management for Bromley Health Bromley Healthcare. She's a locum PCN and pharmacist who visits around different GPs giving advice and support. And she's representing the British Islamic Medical Association. So we should have Sister come on now. Sharifat, are you here with me? So she's there with us now, and we will ask a few questions from myself, and then online we'll check online those questions, and then we'll give her 15 minutes, and then we'll move on to our next guest. Is that okay? Assalamu alaikum, sister.
Alaikum salam wa rahmatullahi wa barakatuh.
How are you doing today?
Yeah, I'm all right.
Jazakallah khair for coming. We really appreciate it. I know you must be really busy, and amazing work that British Islamic Medical Association are doing.
Yeah.
I know you're really busy as well.
It's been a very busy time.
So obviously trying to get a doctor in. Okay. I can imagine. And thank you for all you and all the NHS staff, mashallah. They're doing an amazing work being on the front line. I wanted to start by asking one of the basic questions. There are so many rumors going on, as you know. Today is a bit funny one. I don't know if you guys seen the 5G one. I don't know what's 5G and coronavirus and everything else. And there's so many other rumors about how it spread, how it doesn't spread, what to eat, what not to drink. I think it would be good if you can give us a brief summary of what the virus is and how does it actually spread and so on.
Bismillahirrahmanirrahim. I mean, it's a busy period for everybody, and including people that are medics, people that are working on front line, people that are home, people that are selling things, food and supermarkets. But I mean, at the moment, I mean, everybody, we have read so many things, we have had so many things, and people are saying so many things. Yeah. We don't know that. And some of them are right, some of them are not. I mean, virus is caused by an aggregate or collaboration of some viruses, and they cause some flu-like symptoms. I mean, for this particular virus, I mean, the incubation period is between 2 to 14 days. Okay. And why we were told that if you have these symptoms, you have to self-isolate. And if you have the serious symptoms, you have to call in or go to the A&E. So on most of those symptoms, as we have said before, are the fever, cough, and shortness of breath, and sometimes you are very, very tired. And at the moment, we know so many people are self-isolating. And how do we get this? How do we transfer it between each other from one person to the other? Let me make it a typical example for all of us. Maybe we have 4 people. We say group 1, 2, 3, and 4. So if group 1 goes out to see, you decide to go and see one of your relatives, and we make that person number B. So on your way in, on your way out, supermarket, you met someone, you met this person and that person, and you are infected. So that means as you're going out, you have infected someone you don't know. By the time you go to visit your family, friend, or relative, you have infected another person. But this person, you don't know, I don't know the person, nobody knows the person. Then you come back again, you come back home. So we're saying, we're waiting for another 14 days for symptoms to show up, for people to be ill. But meanwhile, while we are waiting, to have infected that we don't even know has gone out to see another person. That person has infected another person. And that person has infected, will have gone out to see another person, and that's how it spread. And that is why we're saying people should stay at home. Because the only way you can self-transmit this at the moment, straight in and out, is by coming in close contact by sputum, sneezing, clothes, and things like that. So if you're at work or you're at home or you're at a gathering where there's a lot of isolation, people coming together, talking together, there's greater risk of just transferring the virus, and which is why self-isolation is very, very important to everyone at this particular time.
Okay, Jazakallah khair. It's really good that you've summed it up. As you can imagine, there are volunteers, mashallah, doing amazing work at the moment in terms of serving our community. Then how can they themselves safeguard themselves and their family and their peers? What measures do you think they can take extra in order to safeguard themselves?
Yes, our volunteers, they're doing an amazing job out there. We have some local to me here. And last week I was saying to them that when you go in, you have to be careful. And what can we do? We have to minimize close contact as much as we can. If we are going to drop anything to anybody, we should let them know we're coming, drop it at the door, go back. And that's the best thing we can do. If we call them and let them know 5 minutes I'll be there, drop it at the door and go back. And when we are parking, some of them are parking foodstuffs, some of us are giving things to people. For money, if you're giving money, we advise to do online transfer if that's more convenient. Touching money, sometimes we know that self-transmission is possible. So if you're giving foodstuff and things, drop it at the door. That's the best thing that we have found that works so far. So
okay, so that's really good advice. And we've obviously mentioned the early, drop it or keep your distance like 2 meters, obviously, especially when you're shopping. You've probably seen, mashallah, most of the supermarket, they've boxed it up and they're doing social distance, hence the long queues that we have to do for supermarket and local grocery shop. Jazakallah khair, Sister Sharifat, for coming on. We really appreciate it. Do stay on. What we will do, we will take the questions at the end as a panel with us for, inshallah. And over to you, Sister Fatima, for our next guest.
Thank you. So thank you for that, Sister Sharifa. That was really, really useful and helpful. So our next guest is the director of the Muslim Youth Helpline, and it's Sister Zora Kaku. Sister, are you there with me?
Assalamu alaikum.
Walaikum salam. Thank you so much for joining us. So the Muslim Youth Helpline provides provides emotional support via their helpline. They do training and workshops. They do a lot of research, and they provide that emotional support that young Muslims need nowadays, especially in this kind of like dunya that we have, where people can come from like social media, and it's not just face to face or phone anymore. So can you just tell us a little bit more about the Muslim Youth Helpline? And regarding COVID-19, people keep saying like well-being is really important, mental health is really important, but what can we actually do at home to keep our minds active?
Okay, so I'll tell you a little bit about the Muslim Youth Helpline and what we do, because people who call us, our current clients call us about mental health issues, but really every single person on this call, every one of us who's working from home or having to work from home, sometimes I think we talk about working from home like it's a choice that we made. It's not. We're stuck working at home. It's something we're using to cope with our circumstances. It's hard. But I'll tell you a little bit about what we do. So we are a confidential, non-judgmental helpline. We're completely free to contact. So we work by telephone, by email, and by web chat. It's a completely free service. And the big thing about it is it's confidential, which means unless someone is in harm's way, we don't talk to anybody about what you talk to us about. And the other thing is it's completely non-judgmental. So whatever you've done, whatever you've not done, no one will judge you. We're just there to help and listen and help you through whatever emotional issues you're going through. So to start off with, I'd say, please use us as a resource. I know that sometimes it can be a little bit difficult to say, actually, I need help. But the great thing about calling the helpline is no one will know that you needed that. So if you're worried about people judging you or feeling like you don't know how to cope, that's exactly what we're here for. So to talk about some of the things that are popping up because of coronavirus, COVID-19. So one of the biggest things that's happened is we've had a massive spike in inquiries, and all of those inquiries are related to things like hopelessness, anxiety, coping skills, panic attacks, isolation, loneliness, financial stress, depression, having no support systems, all those sorts of things. And so I think the first thing that I think is really, really important to mention is that it's okay not to be okay. This is really, really hard. You might be working, you might not be working, whatever your circumstances are. It's a scary time. It's difficult. And I think just stopping and acknowledging that actually, maybe we're not supposed to all be coping perfectly well with this. It's okay. It's all right to just stop and say, you know what? This is really hard, and we're all trying to make our way through it. We'll all try and help each other, and particularly on this call, we've got a massive group of volunteers, which is incredible. So already people who give a lot of themselves, and it's really important to remember that as you're giving a lot of yourself, it's really important to think about yourself too, and making sure that you remember that you cannot pour from an empty cup. So make sure you fill that cup up for yourself too. So just a few quick things. One thing to know is that we've got some resources around mental health during coronavirus up on our website. So myh.org.uk/coronavirus. We update that every single day with new tips and things that you can do. So just to kind of answer your question though, I think when you're thinking about how to stay well at home and how to stay emotionally and physically well at home, is think about those things in different ways. So think about your physical wellness. So make sure that if you're working at home, you're sat in an ergonomic work environment. Work should be sending you some keyboards and laptop risers and things like that. I know it's quite overwhelming sometimes looking on social media and seeing people have got this, this diary that looks like everybody wakes up at 6 o'clock in the morning, and then at 7 they do this, and at 9 o'clock they're all doing the body coach thing, and then at 11 o'clock they're doing these things. And the thing is, those schedules are useful, but I don't think any of us actually stick to them by the minute. So it's the idea of trying to have some kind of routine, but not necessarily exactly to those sort of timelines. So make sure you stay hydrated, access nature whenever you can. It's really important to try and do that. Try and get out and have your walk in a day. See if you can get to somewhere that's a bit green, that sort of thing. Emotionally stay connected with yourself, so you can stay communicating with other people. making sure you're doing some self-care, and making sure you're avoiding burnout. So really do try and have your work time, your volunteering time, and time for yourself and your family. It's really important. And the last thing I'm going to say to add in there is spiritually. So think about mindfulness, think about how you can connect with whatever you think you can do spiritually to make sure you can get that mindfulness going. So you're really thinking about your internal self as well as what you're doing outside.
Fantastic, thank you so much. And I agree with you, it's really important to look after yourself. And, you know, with this situation, a lot of people are finding that, you know, they're either working from home and they're feeling that loneliness and isolation. But then there's that other side of it where people are now from big families are now all stuck together in the same house, and there's that stress as well. So what tips would you give to people who are kind of stuck in that situation? How can they still look after their own well-being with the stress of everyone else around them?
Well, just to kind of lighten the mood a little bit, I did read something about China that's been in a lockdown for longer than we have. Them talking about the divorce rate going up after lockdown, but also the birth rate looks like it might be going up afterwards too. So who knows whether this is a good thing or a bad thing. But just in terms of how to cope with living in the same space with larger families, or even if it might be two of you stuck in one room or something like that. A couple of tips that might help, and again, these are on the website mych.org.uk/coronavirus, just in case you want to read the full list, but just a couple of them. One is just remembering that falling out and disagreements are normal. It's really normal, and it's really expected that if you're in the same place at the same time, it's going to happen. We really don't usually spend this much time with each other, so it's important to acknowledge that it might be difficult. Communicating about it is really important. So you might find that some people need a bit more space, some people need a bit less space. Some people need space in the morning so that they can have their morning to themselves and think, and they're used to having that on their commute or at work, but they're not getting that in the morning. So it's important to speak to each other, talk to each other. What kind of space do you need, and how do we give you that kind of space? And the other thing is making sure that that quality time is quality time. So instead of kind of trying to be in each other's space all the time and talking to each other all the time, it might be important for you to say, okay, well, actually between 9 o'clock and 1 o'clock, for example, we're just going to get on with our own work and not worry about feeling like, if I'm going to make a cup of tea, do I need to go and find out if everybody else wants a cup of tea? Actually, I'm just going to do my own thing for those 4 hours. And then why don't we have lunch together or something like that? And if it's better for you, then don't speak to each other during the work day and get on with your work, and then actually have quality time in the evening. But spend some of that quality time doing stuff like board games or downloading apps that you can use to communicate with other people. There's so much you can actually do at home to try and take your mind off the fact that you're sitting at home. So there are a few things you can do. But then also just don't be afraid to take that time. If you just need some headspace, to actually say, you know what, I just need a little bit of space for a little while. I'm just going to go to the other room for a bit and I'll be back in an hour, or whatever it is that you need to say. But just make sure that you're getting that time that you need.
Those are really good points, Alison. So I've got another question. I think someone's asking is, what can I do for a friend whom I'm worried about their mental health status? So what can they do? They realize, you know what, I think he's not doing too well, and he's not probably talking to me. He's isolating so much that he's not even talking to us in a group chat, and they feel worried. What can they do?
That's a really good question. So I'd say two things about that. One is, if you're ever stuck for ideas on what to do with a mental health issue, it's perfectly fine for you to call the helpline and say, actually, you know what, I've got this friend and this is what they're going through and I'm not really sure what to do. What do you think I can do? Because the people who we have on the helpline are super qualified to be able to answer those questions. But the other thing I'd say is, we work a lot with emotional support in terms of a counselling based thing where you're listening to someone and helping them through the issue, but then also some signposting. So if you're worried that your friend is going through something serious, I know that things like GPs appointments and things like that are really hard to come by at the moment, but there is still some provision. And even IAP, the local services, they're working online as much as they can. So there are some services, and helplines are actually quite useful. Really, this is the moment for helplines to shine, really. Because if, for example, you think your friend is going through suicidal feelings, for example, calling the Samaritans is a really good idea. If you think someone's going through an eating disorder, BEAT, the Eating Disorders Helpline, is a great place to go. And again, we can signpost you to those all from the helpline. But I think just going back to the thing we just talked about, communicating with them and actually just keeping that line of communication open knowing that they've got someone to talk to is really, really important. One of the most interesting things I think about some of the calls that we have on the helpline is often it's not really, we don't do solutions. We don't tell people what to do. We don't kind of listen to their things and say, oh, okay, you have these 3 options. Why don't you do option 2? The main thing I think that benefits our clients is just having somebody to listen to what they're going through without judging them. So being able to do that for your friend is a service in itself. Even just being able to share the burden and share that load is really, really important. So if you can just even do that for your friend, it's important. And if you can't, and it might not be you, it might be that they're not comfortable talking about something, or they're worried about something that they just really, they find embarrassing, or they're just not in a place to reach out for help. Make sure that they've got contact details. Send them contact details of our helpline or any other helpline that you think would be useful, and just make sure they have that, so that in that moment when they're thinking, I don't think I can cope with this, they know where to go. They think, oh, I can call this helpline, or I can call this person. That's the important thing.
Thank you for that. I really appreciate it. I know there's some questions on there. We will get Sister Sharifat back on, the pharmacist who's joined us from British Islamic Medical Association. For those of you that are watching, we have the Muslim Youth Helpline poster on there with the telephone number, but check the website out and the telephone numbers there as well for you to access. So it's, once Zahra's been talking all this time, the poster's been on there, so people have your number, inshallah. It is a really good helpline, and I think it's important that we look after each other's health and well-being. So what we will do now, there's 4 of us here, and we've got a question. We'll start with Sharifat first. Someone's asking around, is light exercise enough, like having an hour of exercise enough, or in terms of how do they balance it out? Some of them are quite nervous to go out as well. So what can they do in terms of exercises at home, or how do they keep fit?
I mean, at regulation is saying for adults, we should try to have an hour exercise per day. So if you are fortunate to have a garden, you can go into the garden. And one of my sisters was saying she go up and down the stairs. That's good. And for children as well. I mean, you have to go out. So when we're going out, we have to maintain the distance as well. If you don't have a garden and you have to go out, just within 1 to 2 kilometers within your household. So to in and out and back in. So the best thing is just to maintain the distance, follow precautions and all the safeguarding rules.
Spot on. Another question. This is for Sister Fatima and me actually, but we'll get you to go first. Should I expect the organization I am working with to provide protective equipment? It's a very good question.
If the organization is asking you to get involved, then they have a duty of care towards you. So they should be providing you with the protective items that you need. Something that's really important, if you do not feel safe volunteering, don't volunteer. As much as Abdullah and I are planning trying to recruit volunteers and the rest of the MCF organisations who do need volunteers out on the ground, because we are all working to deliver emergency packs and things like that, we still have to stay safe. And all of these organisations in MCF have a duty of care towards our volunteers. It's like we are safe, we do need to safeguard them. So yes, organisations should be providing protective items, and this is in MCF's guidelines as well, that you can read more information on.
Sure. Zafar, did you want to say something, sorry, before?
But just going to say, when it comes to physical exercise, there's physical exercise, but there's also just keeping yourself well and healthy and stretching. So one really important thing, if you're sat at a desk all day, just get up and stretch, just stretch a little bit, it really helps.
Spot on. I do PE with Joel, I know, every day so far, alhamdulillah, and that's been amazing. Half an hour workouts, someone like me was very unfit, not only running up that is running away from a dog, but it is really good, I think having those exercises. I want to speak, Sharifat, someone's asking around, how do we maintain a timetable, or what do we do? What's the best way of ensuring we eat healthy, especially at home? I'll be honest, been eating a lot. I don't know about you guys. I think maybe because we've been in the house and you have to have breakfast, lunch, and dinner, and maybe it's my mental day thinking, oh my gosh, I'm eating a lot. But actually, I'm having cleanings that I would do on a normal day. So how do you maintain being healthy as well as fit and being in isolation?
Yes, what we find out is most family now eat out of the fact that they don't have anything to do. So what we are advising family at the moment is to eat healthy. At the same time, they have to make a timetable of what they're eating, especially with our children that are home at the moment and the family. So when we have breakfast, lunch, and dinner, then when we are having snacks, we have to limit and regulate the timetable of what we're having at a particular time of the day, what we're having, and we have to stick to it. And at the same time, we have to encourage people to drink water. Drink water as much as possible, avoid sugary drinks, chocolates, and make sure whatever we, exactly.
I'm guilty. I'm guilty.
Everybody is there, isn't it? Exactly. So when we do our little shoppings, when we rush out to get some shoppings as much as possible, just live a normal life. Normal, what we normally eat before, vegetables, things, good diet, exercise. We just make sure that we maintain the distance that we have to maintain, and we ensure when we sneeze, we use our hands, we clean the surfaces within the household, and when we wash our clothes, we wash it properly. And when we're at work, some of us that go to work, we cover ourselves, we use our masks, we use gloves when it's necessary, and I work in a pharmacy where we see a lot of issue at the moment. Yeah. They come close to you, they want to talk to you, they still want to come a bit closer. You have to shout to touch them a bit closer. So as much as possible, when we go out as well, we have to maintain this distance, keep ourselves protected because of our family, and keep our family protected as well. And if we suspect that we have come in contact with anybody we feel that has this virus, please self-isolate. It's very important that we self-isolate.
Thank you. Just wanted to say, before Fatima's got another question, I think she saw, on Facebook, there's a comment section, there's a feedback form. We'd love to hear how you thought about this webinar, what maybe we should cover in the future, what we can do to improve maybe. So we want to hear your feedback. It'll take only a few minutes. So when you get a chance, check the comment section. Anas is on there moderating it on our behalf. Fatima, over to you for a question. I think you've got.
Yeah, so I've got a question from a member of the audience for Zora. So someone's asking, what is well-being, and how do we know if we are so we're doing all these things to look after our well-being, but what is it exactly, and how do we know we're doing it well, if that makes sense? That's a really broad question to ask.
You know you're doing well-being well. That's an interesting
Exactly.
Well, the thing is, I mean, there's a definition of well-being that that we use at the helpline, but I think that the main thing to just think about is to ask yourself the question, how am I doing? But really to take a minute and think about, just take a breath, like an actual breath, just stop and take a breath, which takes some time, and just ask yourself, how am I doing? Am I okay? And the thing about doing well-being is, I think it would be a bit of a disservice to say to yourself, well, actually, I'm doing well-being this well, and I could be doing this well. And we could all be doing better things. We could all be taking care of ourselves better. As just mentioned, we could be probably eating better. We could be exercising better. We could be doing loads of things better. So I think rather than comparing yourself to a kind of ideal of this is what the best well-being kind of looks like, think about how you're doing, and think about how you might do things better for yourself. So for example, it might be that your well-being is something you might work on is your food, for example. One thing we say to people who have anxiety all the time is one thing to give up is caffeine, because it can kind of make you a little bit jittery. And so if you already have an anxiety disorder, it's not a great idea to be having caffeine. But in this day and age, it might be that maybe all of us need to be having a little bit less caffeine and being on edge a little bit less, especially when we're sort of cramped up at home and things like that. So it might be that your well-being this month is actually about not having caffeine in your diet. So I think it just depends. Think about your well-being in a few different ways, though. Think about, am I being fully functional? Am I emotionally well? Am I physically well? And to think about it in different aspects. And again, loads and loads of tips on what you can do. But I think it'd be really hard for us all to say, okay, I'm going to take up all these 100 tips about physical well-being and 50 tips on emotional well-being. I think just pick one thing that's good for you for this moment, and that's the thing you need to do.
That's fantastic. Thank you so much for that. That's really, really helpful. And Abdullah, we've got a question.
Okay.
So our question is from the volunteers. How do they kind of balance that wanting to go and help people, yet trying to keep themselves safe? So how do they fight that in a battle? Because obviously all of our volunteers, alhamdulillah, they all want to do good. They all want to go and help people. So that people have that superhuman syndrome, which is great. But how do they battle that in terms of going out, helping people, but also trying to stay safe? Because obviously a lot of us are scared about getting.
That is a really difficult question, and you're asking the wrong person who can't even balance work, family life commitments. I think, do you know what? It's a very good question. I think as volunteers and I volunteer as well. I've been volunteering for my mutual aid group. I've been delivering food to people last week, alhamdulillah. Some of our amazing volunteers have been doing so much as well. And do you know what? To visually understand this point is to think about being on an airplane. I love traveling around the world. Some of you that follow me on social media will see. And remind me of being on an airplane. When the oxygen mask comes on and they give you a safety training, you know you're supposed to watch it. And I probably watched it so many times for some of you. When the oxygen mask comes on, what do they tell you? You got to first do yourself, put the mask on yourself, and then the child. Does that make sense? So in order to save someone, don't think, you know what, forget about me, I'm going to save, but you can't save the person next to you if you don't put your own oxygen mask on. Has everyone visually got that? That's the most important thing. So it's important that we safeguard ourselves, our own health, our own well-being, and we look after ourselves, be physically fit, able, as well as mentally be ready to deal with it. Because some people suddenly, it's an easy task, I can do it, I can go out, but actually, when you start talking to people, and like I've delivered in a home where there's a mother with 3 children and her husband disabled, and then she's got no one to drop the food for her. And we were lucky, we were neighbors to be able to drop that food for her. She appreciated it, and she showed that appreciation and kindness. And sometimes it gets to you, all human beings, and think, subhanallah, and you think, you know, everyone around you, mashallah, doing really well. So think about that next time you go out and think, no, I can help. If you think you've got little of those symptoms, best to stay home, put that oxygen mask, and when you're ready, inshallah, you can put it on someone else.
Absolutely, great advice. And something that we always know is like the intention is important. So Allah knows your intention. Just having that intention to go and help people, you know, it's rewarding in itself. So great advice, Abdullah. I think we've got time for one more question. Yeah.
Go on. Someone's on. Will there be further training that will provide more practical advice? MCF obviously have today launched the guidelines. So there's some practical tips and advice, some which we've covered earlier in the show. We're more than happy to do it again, inshallah, with more practical advice, more people from the ground. And we're more than happy if you suggest it and want it, we can look into that. Looking at the time, we've actually got a few minutes left. What I'll do, I'd like to go around the guests and ask them last few minutes and last thought for our volunteers and those public that are watching on Facebook Live. Shall I start with Sharifat? Any last words from yourself in terms of this stuff and key message that you want to pass to those people watching at home?
Yes, I think I want to emphasize the fact that when we say stay at home, people should please stay at home. And when you go out to go to pharmacy or any supermarket, please maintain adequate distance and only go out when you need some things. And in pharmacy, I'll give example, community pharmacy is chaos at the moment. People come in for silly things. They come for medicine and they still shop for things that they're not necessary. You give someone has got the medication for 2 months at home and they come back to get more. All those things, please, we tell the public to please be considerate as much as possible. Not for us, for everybody. So, and most important, we have to be kind. And if you have elderly patients, please keep them at home, let them stay at home and don't go and visit them. Speak to them, but don't go and visit them. We don't know what you are carrying at the moment. So that's the only message I can pass.
Jazakallah khair. Thank you for coming. Really, really appreciate your words and your wisdom. Zahra, how would you like to sum up?
So just to sum up, it's okay to not be okay. Please be kind to yourself, everybody. And for more information about staying well during this time, myh.org.uk/coronavirus.
Thank you. Fatima, last words from yourself. It's been amazing hosting with yourself, by the way.
Yes,
so you know. Thank you both of the guests as well. Go on, over to you, Fatima.
Yeah, absolutely. It's been amazing being on this panel with everybody, hosting with Brother Abdullah, working with Brother Anas, and obviously our guest speakers. Just to say, like, thank you for joining us, but please make sure you do take on the advice, do your bit for family, friends, neighbours, but also do your bit to prevent the spread of the virus. And just remember, #TogetherWeCan.
Thank you very much. First of all, thank you to our amazing guest and my co-host for coming on a Wednesday evening. I'm forgetting to lose the days now. They're very important, both from really both important organizations. As you know, Muslim Charities Forum has launched this national solidarity campaign, not only fundraising, but volunteering. And you know what, the beautiful thing about this, I was telling Fatima earlier, is that you look at all the logos that are there, we're all actually working together, united on this cause. Because sometimes trials and tribulation brings people closer together. As you all know, Allah's testing us to see how we are, how we support, and like Sharifa said, are we kind with others? And like Allah says in the Quran, whoever saves one life, it is as if they have saved all of mankind. So one way of saving life is maybe stay at home, or if you can volunteer, by all means volunteer, but always check government advice, and like the Muslim Charities Forum page, so we can see you soon, inshallah, with more program, webinars. So keep safe, stay at home, and make dua for us, inshallah, in these troubled times, and have hope. There is hope, inshallah, and see you soon. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh.